Namaste everyone. So today for the first time I am coming underneath the PPT slide. Okay. So some advancement I have done in share screen in the Zoom call, and welcome all of you to this program on World Mental Health Day 2023. As you can see on the YouTube, the theme of this year is mental health is a universal human right. Mental health is a universal human right. We have Dr. Sowmyashree, who is a child and adolescent mental health specialist with all of us. She happens to be my wife as well. And we are going to understand. Namaste, Soumya.
Namaste. Namaste, everyone.
So you can ask us questions on mental health on the YouTube if you wish to. And we are all waiting for your questions. Along with that, we are going to share a story of how it is important to manage our health, specifically our mental health. Because physical health is one thing which is dependent on our mental health as well. We will understand as we go on, we will understand how physical health is also important and how it is dependent on mental health. So anybody knows, Soumya knows because I have shared this story with Soumya. Soumya can tell us who is she. Soumya.
She is Carrie Cunningham.
Carrie Cunningham. She was a very well established international tennis player, and she right now is a surgeon. And we are going to share the story which she herself has shared on international platform of American Society of Surgeons. In their presidential speech, she opened up completely about mental health and its issues, which have engulfed so many doctors as well. So if doctors are shy of mental health, then we are really in a very interesting situation, and we need to open up as much as possible about mental health. So Soumya, I'm going to share the story. So Carrie Cunningham, well, she was giving her presidential speech. She has opened up and she has spoken about so many things. Welcome everybody on YouTube. Please ask your questions if you have any. Carrie Cunningham puffed out her cheeks and exhaled. She looked out at the audience filled with 2,000 of her peer surgeons who were attending the annual meeting of Association of Academic Surgery, a prestigious gathering of specialists from universities across the United States and Canada. One more thing, we're talking about developed world, first world countries. Okay, that is the situation of mental health in first world country. Please underline this. Please listen to this carefully. That in developed countries, in first world countries, there is a stigma about mental health. There is a problem about mental health, even in doctors, and how they have come out and spoken, completely. They have barren themselves about the truth of mental health in medical field. Cunningham, president of the organization, knew what she was about to reveal could cost her promotions, patients, and professional standing. She took a deep breath. I was the top junior tennis player in the United States, she began, and I am the associate professor of surgery at Harvard. But I am also human. I am a person with lifelong depression, anxiety, and now a substance use disorder. The room fell silent. Cunningham, she is a surgeon, and she is expressing about she having lifelong depression, she having lifelong anxiety, and she is having a substance use disorder. She's going to reveal everything in the next 54 minutes of her video on the Association of Academic Surgery presidential meeting. Okay. And Cunningham knew others in the room were struggling too. Doctors are dying by suicide at higher rates than the general population. Somewhere between 300 to 400 physicians a year in the United States take their own lives, the equivalent of one medical school graduating class annually. Surgeons have become some of the highest known rates of suicide amongst physicians. And as you can see here, of 697 physician suicides reported in CDC National Violent Death Reporting System between 2003 to 2017, 71 were surgeons. Almost 10% were surgeons. Many more go unreported. So this is very, very revealing. So Soumya, you can tell about your own experience in this field, and you can share some of your expert opinion on this.
I think this is quite alarming, and it's not a situation that is specific to one country or another country. I think this is a global problem that doctors and physicians and students who are training, though they have to show or portray to the world as if they are so strong, honestly, they are dealing with life and death every day and going through very vigorous training with very much packed routine, no proper sleep, no proper mentorship, no proper support. So even in our setting and even in the West, I think the situation is very similar, where and in fact, you all would have read news, no, that every now and then you'll hear somebody in IIT committed suicide, or somebody in this medical college, somebody in that medical college. And even in some of the most prestigious mental health institutes of our country also, doctors have recently committed suicide. So it's really a very sad state of affairs.
Thank you, Soumya. And yes, we need to bother about it. There is one more thing about suicide is coming. If somebody has attempted it or somebody has gone away because of it, there is a stigma around it, and people don't respect the people who have suicidal tendencies, or who have the family who have committed, or who have died by suicide. So what I mean to say here is that the stigma has led to one kind of isolation amongst people who have such symptoms or such thought process, and because of that, there is no chance of entering into that person's psyche and help him or her out from the situation. We'll go on with Carrie Cunningham's story. When Carrie Cunningham was 7, her stepfather put a tennis racket in her hand and discovered a prodigy. She quickly became a star, competing in international tournaments barely 3 years after she had first hit the ball. Means by 10 years of age, she was in international tournaments. By 12, she had her own psychologist and nutritionist. She was put on 3,330 calorie a day diet, aiming to gain 3 lobes each month on her 4 feet 7 inch frame. And she had run so fast that she would hyperventilate. Her legs bore constant bruises from banging her racket against them. She was praised for being scrappy and mentally tough, for being a perfectionist. In 1987, when she was 16, World Tennis Magazine named her top junior female player of the year. The next year, she made her debut as a professional player. In one of her first major tournaments, the teenage Cunningham faced the top-ranked Steffi Graf in Australian Open and lost, but barely. A psychologist taught her to hide her feelings from her opponents. Never let them know you are struggling, went the mantra. So Cunningham mastered the art of disguising her emotions. An outside observer would see a determined athlete. Inside, Cunningham felt riddled with anxiety. So Soumya, what's your say on this?
I think it is basically leading us to all possible signs of anxiety and all possible signs of going beyond in order to reach somewhere, reach to your goals. But I don't think it is a healthy way of approaching any situation or learning any skill for that matter, because I think more than feeling anxious, or like it says, for praised for being scrappy and for being a perfectionist, I think it's essential to be inclusive and essential to accept people the way they are, the way they can do things in their own unique ways. Not necessarily everyone will be world number 1 or world number 2. But at the same time, at the cost of what are we doing all these things is also something that we have to keep in mind.
What is your say on hiding the emotions or hiding the feelings? Do you come across parents who tell their children to hide their emotions, not cry, not share their emotions?
Yeah, I think it's a very valid question and very, very important topic, because our society is made in such a way that only people who portray as if they are strong and hide their emotions are, portrayed as if they are the strongest and the best in the society. Unfortunately, it's very common, far more common than what we hear, that parents will say, why are you you should not show your emotions, tough up, buckle up, don't cry. You should not show, even if you're hurt, you should not show, even if you're exhausted, you should push yourself and not talk about it, and even if you're sad, even if you're lonely. Just to give an example, recently I was one of the panelists in a college, and this girl actually shared to her parents that she was feeling lonely and sad and depressed because she was studying outside of home and living in a hostel or PG or whatever kind of place. And she was telling how her mother said, this is because you watch too much of phone. Don't go around telling people that you're lonely and depressed. But actually, she was feeling homesick. She was feeling troubled, and she was just put down, saying, "Don't just because you're watching too much phone, or just because you're away from home, you don't need to bring up these kind of topics, or हमारे घर पे कोई नहीं है. You have to learn to be strong. It is not true that you can have mental health problems." So I think, like you already have pointed out, stigma plays a very, very major role. But I also think in some ways, media also tries to, portray mental health issues as if it's some kind of a taboo, some issue. Though there are a lot of movies which have portrayed it well. On the top of my head, I can remember that there was a movie called Mental Hai Kya, and Indian Psychiatric Society literally had to write to the censor board saying, you cannot label a movie like your mental hai kya. You actually should. Then they changed. In fact, they were pushed to change the title of the movie to Judgmental Hai Kya or something like that. And to that extent, all these things can impact our common man and at the grassroots level.
Great, great. Thank you. So we will move on with further. When she was 18, she lost in the French Open, and now the defeat sent her into first major depressive episode. She sat in the Paris hotel room alone with shades drawn and hardly ate for a week. After graduating high school, she climbed to number 32 in the world. She appeared to be thriving, but she was racked with loneliness. She did not earn the kind of income that allowed her to travel with family or friends. In an era before cell phones and widespread email, she was on her own. Her closest friends were her fellow competitors, people who understood what her life was like, but not the people she could talk to about her struggles or doubts. Just after she turned 20, she injured her wrist and took 6 months off to rehabilitate and take university courses. By the time she was healthy enough to return to play, she did not want to go back to the road on the road and decided to retire. She spiraled into another bout of depression, again undiagnosed. She had lost her identity, and Cunningham dealt with her feelings the only way she knew, by busying herself with everything but her distress. She moved to Ann Arbor to study at the University of Michigan, loaded her schedule with extra classes, and began training for a marathon. I was awake for weeks, she would say, and I don't remember sleeping at all, but yet I would still work out in the day. So what do you say, Soumya, about it?
Yeah, I mean, I think this story is really taking us through the journey of what one goes through from beginning to end. How initially it starts with trying to be resilient, then you don't talk about it, then you don't seek help, then you become anxious, then you spiral into that, and then you get in, you don't give you're not able to do very well, and then you're not able to bear a defeat or a failure or even a small setback. Here, going to French Open is actually not, I cannot say it's a defeat. It's like somebody's dream come true, but she lost and then she went into depressive episode. But again, she did not seek help. And it's very sad that in spite of being on the top of the game with many resources, if somebody can spiral into depression and not be diagnosed and not know what to feel and not know how to seek help, it's really, really very sad. Then you can imagine the state of affairs for people who are not aware, not in the helm of affairs, not having
our country. It is very, very rough, very rough. In developing countries, it's going to be very, very rough. We will move on to, she does not believe her depression was perceptible to anyone else. She got high marks, she dated, she went to parties, but she often felt that she was separated from the rest of the world. It's like being alone in a room full of people. She was drawn to medicine with its intellectual challenge and satisfaction that came from making a difference. She graduated in 2001 and married one of her classmates. The same skills that made her a tennis phenomenon made her an excellent doctor. Together, she and her husband were accepted for residency training at one of the country's most prestigious programs at Weill Cornell Medicine in New York City. After that, they moved to Harvard Medical School in Boston to do fellowships. Cunningham was on her way to becoming an endocrine surgeon who would care for patients with diseases affecting their thyroid, parathyroid, adrenal glands. And she loved the action of operating room and working with her hands again. Her hands were used for tennis. Now her hands are going to be used for operating on patients. She thrived in long hours and fraternity of people who were taking on the seemingly impossible. On the outside, Cunningham was winning. On inside, there was another story. So what do you say, Soumya, about it?
I can only say we know how many examples like this we have talked about, you and I, in the past many years, isn't it?
Yes.
How people, even though they're amazing doctors, graduated from amazing universities, done amazing, have amazing fellowships and all the XYZ degrees which run after their names. We know some people, I should say, Mayur, that we can probably, this is like a prototype and we have seen so many of them and it's very sad.
Yes. So we will move on and we'll see how the story is twisting. How the story of a woman who is winning from the outside, how she's losing from the inside. In medical school and residency, doctors in training work around the clock. They eat or sleep when they can. Often they are pushed to their limits. They feel miserable, says Jessica Gold, a psychiatrist at Washington University in St. Louis School of Medicine, who specializes in physician wellness. So there is something called as physician wellness in America. Do you think, Soumya, it is there in our country? Physician wellness?
No.
We basically think, we basically think that feeling bad is a part of medicine and we can't identify that we are doing poorly, or that we should take time for ourselves and figure out that we actually might be depressed. Surgery especially has always been cruel to its practitioners, who suffer high rates of burnout, ergonomic injuries, miscarriages, and infertility. They are trained in an apprentice model that lasts minimum of 5 years, but usually 7 or 8. Residents begin as juniors and progress up to hierarchy and adopting the skills and behaviors of those who came before them. See one, do one, teach one is the shorthand of this system. It's how surgeons develop their technical skill set, but also how they conform to cultural norms of the profession. So Soumya, you are a wife of a neurosurgeon and you have seen me in the training. So you can share your own experience as a spouse of a surgeon, neurosurgeon, and you can share few experiences or whatever you feel like for the people to understand.
No, I think burnout is definitely one part of it. I can say that, but it's also the very bizarre schedules, absolutely no support from the system, and long work hours, not having any social or relaxing time in any way. And even the system does not have any way in which they can support the residents in training or surgeons in training, help them to, what I'm looking for a particular word, help them to de-stress, maybe not even relax, I should say.
There is no system. There is no system,
there is
basically.
no system. Absolutely
And
no system.
people either voluntarily or involuntarily are trying to destroy each other's mental health.
I think in the name of competitiveness, they really destroy each other's mental
Or
health.
in the name of perfection.
Rather than in the name, of
perfection.
Yeah.
In the name of competitive world.
Yeah. Competition. Unfortunately, they don't realize that they are supposed to work collaboratively, be supportive of each other. Yeah, I agree with you.
One very interesting slide it is. The training system was developed by William Halsted, a pioneering surgeon who worked at St. John's Hopkins Hospital in the late 19th and early 20th century. Halsted battled addiction throughout his career, even as he revolutionized surgery by addiction control. He became hooked to cocaine in 1884 while conducting experiments with the drug. Using morphine to help wean himself off cocaine, he developed a new addiction that plagued him until his death at 69. He became erratic and withdrawn, sometimes disappearing for weeks at a time. His oddities, though, were tolerated because of his enormity of his achievements. This man created a culture where you lived in the hospital, says Michael Madoff, a retired surgeon who developed a narcotics addiction while working as a professor of surgery at the University of Minnesota. Part of the ethos that is you don't complain, you just do your work, you shut up and have discipline to be strong and pretend you are okay, and when everything is not. Soumya, it's yours now.
Yeah.
Sometimes our parents also tell this kind of thing, that pretend everything is okay, even if it is not okay. Sometimes our teachers tell us, pretend everything is okay when it is not okay. And that is why we are not able to come up, we are not able to tell that we are in distress. Soumya.
No, I agree. And this is how people get into substance use. This is how people go the wrong way, because there's no place to vent. You want to vent out even to your own parents, like you said, or even to your brothers or sisters, or even to your friends. They all either don't get it or they don't want to get it because the system is like that, or the society is like that. There's so much stigma. And in that sense, a lot of people go down the addiction path, go down the wrong ways. Find other ways to subdue their pain, which is actually very sad, because they're going down the rabbit hole. They're making things worse for themselves by doing all this.
We have Rakesh Kumarji with us. We have Pratap with us on YouTube. And Rakesh Kumarji is asking, Sanjay ji has joined from Lucknow, Simplify India. And we have Rakesh Kumarji is asking a question that in his family, that 17-year-old child who is very good in studies but is extremely erratic, and she likes pouring water in the bag of fellow students who don't talk to her, and she cuts her eyebrows and all these things he is telling. And I think that he's asking that she needs a psychologist or a psychiatrist. So Soumya, you can answer this, who she should meet.
Rakesh Kumarji, this is something which we call as oppositional defiance or conduct disorder. And it happens because of multiple issues, because while growing up, she might have had some trauma. She might have not had trauma, but parenting patterns might have not been okay. She might be in the wrong peer company, even though she would have had good parenting. Her peer company would have been very bad. So first is to identify what is the background of all of these issues, because behaviors generally, unless it's very organic, something like schizophrenia or something like major depression, these kind of erratic behaviors are consequence of something else that would have triggered a series of events. So we have to go back to that and try to understand from where all this stemmed and what was the cause of all these problems. To answer the question whether she needs a psychologist or a psychiatrist, psychologist is somebody who will help with behavior, do therapy and work, and psychiatrists are the ones who will identify what the problem is and give medication and support in that way. So initially, to start with, they can meet a psychiatrist or a psychologist. It does not matter. Many times we work together. Psychiatrists work with psychologists. Psychologists will have to work with a psychiatrist. But it depends on whoever can help her. That is what is most important. Over to you, Mayur.
Thank you, Soumya. Now we will move on to the next part of In 2003, the Accreditation Council for Graduate Medical Education, which oversees medical training in the US, ruled that trainees could work a maximum of 80 hours a week in clinical care. The first time that any national limit had been set on trainee work hours, it cut into the 100-hour plus weeks that were off norm in the surgical trainees, for the surgical trainees. But many surgeons protested that reduced schedule did not leave enough time to adequately train the surgical residents. When an 80-hour work week for residents was first rolled in 1989, surgical trainees were exempt. In response, surgical
Okay, it seems like Dr. Mayur is having a technical glitch. Let us just wait for him to join back the meeting.
Somehow I got disconnected.
Yeah, but I said that.
Are you able to hear me?
Yes, yes.
Okay.
We are still live on YouTube, so you can go ahead.
Yeah, I'm going ahead. So we were here about the surgery, about surgery being one of the most interesting residencies, interesting training, interesting way of practicing medicine. And here, one of the first lessons of surgery is that surgeons are expected to take responsibility for what happens to their patients. American College of Surgeons, in a document for medical students that outline the skills needed to become a surgeon, says, at the core, surgeons must be able to accept responsibility. And in the name of accepting responsibility, what happens to their minds is very, very critical. So, Soumya, your insights on this?
I think you keep talking about circadian rhythm. And as you can see, if there is 80-hour week with night duties and all those things, or 100-hour plus week, then you don't have enough time to reset, take care of your health, take care of your social life, take care of your personal life, take care of other things that on a routine basis every human being will face. So definitely it is a challenge in itself to navigate through this. But in the absence of a system to support, then I think it is a catastrophe, as they have written there.
And it's the catastrophe happening in the developed country.
True.
This is this is one thing which we always have to, sometimes we are so unconscious that we don't want to accept that there is something wrong going on. We think it's all right because it has been for so many hundreds of years like that. The heightened sense of responsibility comes at the personal cost. Surgeons often fall into a trap of feeling like what they do needs to, if you will, for a patient, says Colin West, a professor of medicine at Mayo Clinic who specializes in physician well-being in US. When a patient does poorly after an operation, emotional turmoil, anxiety, Soumya, frequently it is disconnecting. I don't know why, but anyhow, I will try to wind it up as soon as possible. You unmute yourself. Unmute yourself.
Keep your video off, and I think it might work.
I don't know, Soumya. Okay, I will try to keep the video off.
Yeah.
Do you think it is because of the video?
No, your voice is still a little patchy.
I think it is because of poor connectivity, maybe. Okay. When a patient does poorly after an operation, especially when there has been a mistake in their care, surgeon suffers emotional turmoil, anxiety, sadness, guilt, and shame. In 2017 study, an anonymous surgeon described the aftermath of an error. We all hide our grief, suffer in silence. The pain can be close to debilitating. What do you say, Soumya, about it?
Yeah, I mean, you can see that there is emotional turmoil, anxiety, sadness, guilt, shame, and imagine that a surgeon is going through all these things. How much more traumatic it might be.
On Cunningham's first night as an intern, 3 of our patients died. Their deaths were expected, but the losses still hurt. I did not know how to call out a death certificate or even pronounce someone dead, she recalls. And I was like, I guess I'll get used to it. So what is your say about it, Soumya?
That is what we are taught, no? That you have to learn to pronounce someone's death, and you have to learn to be strong about it, and you're still supposed to be okay, go home, sleep well, eat well, and take care and behave as if everything is normal. It's very sad.
And in 2012, death hit very close to home. So this is what we are going to see, what happened exactly, and from there onwards, how the things are unwinding very badly for her. Okay. So Cunningham first met Christina Barclay during medical school at the University of Michigan. When Barclay was a few years behind, they met up again at Harvard. When Barclay arrived to start a surgical residency, their partners were good friends and they became friends. In last year of residency, Barclay had a mental health breakdown. She saw a psychiatrist at her hospital who started her on medication, and Barclay quickly returned to work. She felt pressured to finish her residency program, says her sister Jill Barclay Roy. That was the resounding message from everyone in her life, probably me included. 6 months later, a neighbor found Barclay at home with self-inflicted wound. Barclay's colleagues believe she tried to take her life, but her sister is convinced that Barclay's intention was not to die. She says Christina told her that she would just 2 years. Barclay cycled in and out of hospitals, oscillating between depression and mania in her life. I felt very angry for a very long time at the medical field, says Barclay Roy. My sister was so fearful about ramifications of her career and ramifications to her job and her reputation. Cunningham was shocked at Barclay's death. We imagined a lifetime of incredible things she would continue to do, not only as a surgeon, but as a wife, as a daughter, as a sister, and as a friend. So she's Barclay, and she's Barclay, and she's Carrie Cunningham. So what is your say about this, Soumya? Now the story has become dark.
Yeah. I mean, it's very, very, I mean, I cannot even imagine what she might have gone through. And it's very sad that.
One thing is in our medical field, we are forced to become strong, forced to not do all this. I will tell you, ye nautanki kar raha hai, like that they will tell. He is doing drama, like that they tell. Correct? You would have seen many of our colleagues also, if they are struggling, they have been told that he is doing drama or she is doing drama and he wants to escape work or she wants to escape work. And we can't cry, we can't express our depression or whatever it is. Okay. I urge through this platform, I am urging everybody that please take care of yourself, take care of your emotion. If suppose somebody is not understanding, please seek professional help. If you try to convey it to your colleagues or seniors or juniors or whoever they are, they may not be in the state of understanding it, and they may take it some kind of professional rivalry kind of thing, and they may misuse your emotional situation into finding their own competitive benefits. And this is what I have seen around. That's why I am sharing. Over the next decade, Cunningham's career soared. She became an associate professor of surgery at Harvard Medical School after the death of her friend Barclay, and received a grant from the National Institutes of Health to investigate thyroid cancer. She was appointed to Exeter and also came and went repeatedly. She saw therapists on and off, but did herself with a little more deeply in work. But the busier I was, the better. She says, going on vacation was just a torture for me because percolate. Then the pandemic hit. So, Soumya,
Again, I think we lost you.
I think it's about our connection, my connection. Yeah. The internet is patchy. Yeah. So basically, she would bury herself into work, and then through that she would try to compensate. Okay, and because of all these things, because of all these things, slowly things are going to become bad for her own life. As we go through it, we will see. So what do you say, Soumya, about it? Then the pandemic brought upheaval. After 25 years of her marriage, Cunningham moved out of the family home. She and her ex-husband, also a surgeon, remained good friends. It means that she had to divorce. But the split was crushing. She felt like she was failing as a mom. She had frequent panic attacks, which she hid from her colleagues. And a few friends questioned her about her mental health, but she used to push them off. This is being done by a doctor. Okay. So just imagine how normal people will behave. Soumya.
Yeah. I mean, even in spite of me. Can you hear me?
So what do you say about it? Yeah, I can hear you.
Yeah. Now, in spite of being doctors, in spite of being in the system, if people feel like this, then you can imagine. And that we know of people who tried to seek help from colleague psychiatrists or colleague psychologists who just brush off saying, oh, I'm busy. Oh, I don't want to see my own colleague. Oh, I don't want to. What will they think of me? What might they judge me? I mean, even among psychologists and psychiatrists, I think there are a lot of people who have all these kind
Correct.
of block for helping their own colleagues. But I have also seen, but I have very rarely also seen The other side of it, where I know some of my colleagues, pediatricians and some surgeons sometimes have reached out and said, I have a problem, I'm feeling lonely, I have maybe I have internet addiction, that's the way I'm coping with my stress.
I was lucky to have you around during my residency, and now as a surgeon, even if I have some stress, it's very easy for me to घर में ही psychiatrist है, तो I have very easy access to all these things. Thank you very much for your timely assistance in every aspect of my stress. At a personal note, I am openly in front of everybody, I am acknowledging your help and your service in maintaining my mental health. Excellent case study and interesting interaction by subject matter experts. Thank you very much, Savita ji. Please share this video as much as possible. Let people understand that mental health is a very interesting subject, and it is very difficult subject even for the subject matter experts, as we both are discussing here now, that as doctors also we struggle to understand and act on the mental health issues. Okay, so thank you very much for all of you joining in. Now at night, she would come home from work and open the bottle of wine. She looked forward to the way alcohol could prevent her dwellings from the things that hurt. She drank to escape her anxiety and depression, but alcohol wasn't both. She drank more and then more. On Friday night in spring 2022, Cunningham joined some colleagues at a local bar for a friend's birthday. After a few drinks, Cunningham started openly talking about depression. I don't even know exactly what I said, but I was talking about feeling suicidal. She says. The next day, a co-worker called Cunningham's boss and told him that they were concerned.
I think Mayur has another technical glitch. Let's wait for him to join back. I'm not sure if anybody watching on YouTube or on Zoom have any other questions. Let me just see.
Soumya.
Mayur, I think the internet connection is making your voice also break again and again.
Okay. But is it okay? Is it till now people are with us? No, people are understanding what is going on. Yeah.
I don't think you should share screen, but you can continue to read because your voice without screen share and video is coming clearly. So let's try that.
Or better, okay. Or else I think I will share the different way. It will be better. Just wait. I will try to do that, and I will keep my. Now, are you able to see?
It's still loading.
Yeah.
Yeah, now it has loaded.
Okay, done. Are you able to see?
Yeah. Able to see.
Yeah, good. Okay. So as we saw that she started drinking alcohol and her colleagues found out. Her colleagues found out that she's suicidal. They informed to the head of the department. and now she is under evaluation. The results stunned her. Cunningham, who had never had a DUI or any duty under influence or any problems at work, was deemed unfit to listen. She would have to participate in. What is your say about this, Soumya? Soumya.
Yeah.
Soumya.
Yeah. Can you hear me? I think again we are talking about the lack of system support and lack of the support of the system, lack of support from anybody for that matter in the right way.
Yeah. No, but the colleagues now have come up. No, colleagues are helping. They have a system where they can, they can get evaluated, and then they are writing. 50 years ago, in a landmark report called The Sick Physician, the American Medical Association declared psychiatric disorder. Impacted by psychiatric disorders, alcoholism, and drug use, a widespread problem. Even then, physicians had rates of narcotic addictions in 30 to 100 times higher than the general population. And about 100 doctors a year in US died by suicide 50 years ago. The report called for better support for physicians who are struggling with mental health or addictions. Too many doctors hit their elements because they worried about losing their licenses or respect of their communities. According to Medical Association, following the publication, state medical societies in the US, the organizations that give physician license to practice, created confidential programs to help sick and impaired doctors. Physician health programs have a dual purpose. They connect doctors to treatment, and they assess the physician to ensure that patients are to the patient safety. The program may recommend that the doctor immediately cease practice, or they may recommend that a physician undergo drug and alcohol monitoring for 3 to 5 years in order to maintain their license. The client must sign an agreement not to participate in patient care until their personal health is restored or addressed. In rare and extreme cases, the physician health program will report the doctor to the state medical board to revoke their license.
Yeah, I think that is a fear, no, that you'll stop all that you have worked for ever. If it is going to go away just because you're revealing your mental health issue, then you can see the core of the problem.
But we should be very I am very happy to see that this America has their own system where they're addressing and helping the physicians out.
Yeah.
Do you think any such kind of protocol or anything is there in our country?
I don't think so. And we know that in many times in our conferences and meetings, you have also seen, Mayur, that lot of doctors are constantly sharing their substance use, whether it is alcohol or smoking and all these things, and how they use that as a coping mechanism.
I have a question for our audience. That please, can you tell us that have you ever met a drunk doctor? Have you ever met a drunk doctor? Have you ever met a doctor who was drunk while he was seeing you or your relative, or you saw one doctor on duty in hospital? Because I have seen one in my life, and that is why I'm asking. And that we should not hide this. We should because the drinking is not because that person is, the person might be suffering from something, and that is how that person has taken drinking as a coping mechanism. We all know so many doctors who smoke, so that is also there. I request all of you who are there, you can open up this discussion on the chat. Physician health programs are designed to address the myth that illness automatically means impairment, says Chris Bundy, the executive medical director of the Washington Physicians Health Program and the immediate past president of the National Federation that oversees the state programs. An addiction or mental illness may require a physician to take time off but does not justify automatic revoking of somebody's license. And people can function at high levels within their profession very expertly with the depression, with anxiety, with substance use issues. He says that key is to get a physician to treatment early before their condition becomes severe enough to affect the patient care. Soumya.
Perfect. And I think what should be acknowledged here is the fact that they went to that extent to have a physician health program.
Yes. I think it's a very high time that our patients and our doctors, both of us, we have to become aware that we should have this program. And I feel that this video will open up the sympathy and empathy of patients towards doctors, that they should understand that in the pursuit of treating patients, in the pursuit of becoming an expert to treat patients, somewhere we all lose ourselves. What do you say, Soumya? A psychiatrist, Bundy, developed a severe alcohol use disorder, was in monitoring for 5 years, during which time he joined the VA system of chief of mental health. He approached his state physician health program for help. He likes to quip, I am not the only hair club president, I am also a client. He has now been sober for 15 years. But these programs remain shrouded in stigma. Doctors worry that if they seek help, they will lose their license or trust of their communities, so much so that they often stay away from treatment. Lorna Breen, an emergency room doctor in New York, died by suicide in April 2020 after telling her family she was lose her medical license or be ostracized by her colleagues because she was suffering anguish from her work on the crisis. Her family and friends started the Lorna Breen Foundation, which wants to see changes to the medical licensure process. The foundation wants licensing bodies to live.
Okay, we lost him for the internet problems. Let us wait for a minute, and if he's not able to join, I'll just check with him if he's able to join back on the call.
Yeah.
Now, I think instead of sharing the screen, Mayur, you complete the story. You have read the article, right? So you share, because it's your voice also is becoming very, very patchy. Not able to hear you.
So basically, Soumya, what has happened is that she has gone through this whole process. She feels that, she done better in terms of seeking. Should I stop sharing? Okay. Is it okay now? The sound is better?
Yeah, I think so.
Hello. Are you able to hear me?
Able to
Are you
hear
able
you.
to
You
hear me?
continue. Yes, yes,
No, are you able to hear me properly?
yes.
Okay. So basically, what has happened in her life, that she being a surgeon, she has seen a suicide, she has gone into depression, she has been consistently being anxious, she was having the substance abuse, and by God's grace, nothing was impacting the health of patients and patient care. But definitely, it was, internally it was destroying her, and that is where she decided to come out and speak on behalf of everybody, because many of our colleagues, they feel all these things, and she feels that there is some responsibility of her towards her friend who committed suicide, that is Miss Barclay, and she wanted to honor her. She wanted to open up the discussions about what happens to doctors, and she wanted to bring some closure to all these problems which she has gone through. And she says that she will never know what would have happened if those friends have not intervened. Means she would have died if such thing would have happened. Correct? Are you there with me,
Yes,
Soumya?
yes.
Yeah. And she says that I wish I could get those of you in this room that are struggling the courage to take and seek help, but I can't. I can promise you that people will show up for you as well, and you would for anyone else if you would have asked for help. I have to accept that I will always have tough days. I can expect recurrent bouts of depression throughout my life, but it is not a disease. It is not a character flaw. It is a disease. It's not a character flaw and does not define me. Depression, anxiety don't define us. That is what she tries to tell. It's a real watershed moment in the particular profession to be able to say it's okay for us to talk about these things, and let's change the audience. Since then, none of the terrible consequences of Cunningham feared about going public have come to fruition. The only negative effect has been that she was turned down for the life insurance. Cunningham's phone has been ringing off the hook since her talk. Surgeons from around the globe call her to share their stories and thank her for speaking out. She tells them what she told the audience. I do not have all the answers. I do know that it won't get better unless we talk about it openly and honestly. So, this is what it is. Tell me, how would you like to end it?
I think we can end it by discussing the theme for this year's World Mental Health Day, which says mental health is a universal right. And this story
Yes.
only says that it's a universal right of
For all of us.
everybody to feel.
Even if you are a medical professional, you should not fear that you should not stay away from seeking medical help or mental health help, because it's a very different problem. No, it's a problem of like some kind of profession or problem of luxury of being a professional. There at higher level also you are suffering, at lower level also people are suffering, at both the levels people are suffering, and that is why mental health is a right for everybody. At any position it is a right. Tell me, Swami.
True, I agree with you. That's about it from my
Your
side.
See, means I'm not seeing our live chat at this moment, but yeah, what I want to say to all of you is that mental health gets violated at any point. It gets violated inside you. It gets violated with your spouse. It gets violated with your children. It gets violated within your family. It gets violated at your workplace. It gets violated in your country. It can get violated at world level as well. So it's a unique phenomenon which happens from inside out, and it can have ramifications across the globe. It has ramifications across the globe. And that is why we all should understand the importance of opening up, the importance of speaking up, We should not feel alone. We should seek help. If we don't get right people who help us, we should keep seeking right people to help. And somewhere we have to learn to communicate our emotions properly to others. We can fight for our emotions to become correct. We can fight with ourselves, we can fight with others in a positive manner, I'm telling, not in a violent manner. So thank you very much, everybody, for joining in. And if you wish this video has given you some insights, you can like, you can subscribe to our channel, you can post your questions in the comments. We will be more than happy to address your questions and queries. And as always, keep seeking more and more knowledge, keep being more and more human. Thank you very much.